हेलो अब्बास जी लाइव कर दिया
सर।
sorry so for the much delay. There was rain. I was stuck in metro. I got the information last minute for this evening session. Because of the rain, Smithy ma'am was not able to take the session, and I also got stuck in metro. So sorry for the delay. So thank you everyone, those who are waiting for the session. I can see a lot many messages from the people. Okay, so thank you all for joining so late. We are starting 1.5 hours late from the scheduled time of 8 p.m. Just yes. Okay, from the scheduled time of 8 p.m. Okay, so we'll start without wasting any more time. So today is the first session on our INICET PYQs to prepare you for the November INICET exam. Okay, so today I'm going to discuss the May 2023 paper. Okay, the questions, orthodontic questions which came in that exam. Myself, Dr. Rijul Agarwal, I'm the orthodontic faculty in DAMS. So I welcome you all for this session. So PYQs form an important, very integral part of INICET exam, not so much in the NEET exam. Okay, because INICET every year roughly around 50, 60, sometimes more than that, previous year's questions directly come up from the previous exam. Okay, so these help you prepare, keep you track कि जिसकी preparation is on the track or not. Okay, so here is the first question. Which landmark can be precisely marked in lateral cephalogram? Options are nasion, gonion, condylion, point A. Someone says option 1. So yes, option 1 is the correct answer, that is nasion. Now why not option B 2, 3 and 4? Okay, as I say, always say, look at the question, 1 correct, 3 incorrect, why they are incorrect and what more questions they can form. Okay, so this, which landmarks can be precisely marked and not, is a part of sir's book only. This is the text direct table which I picked up from sir's textbook. Okay, so there was a study, you don't need to know the study, which gave the landmarks which have the highest error possibilities and the least error possibilities in marking. Okay, so along the x and y coordinate. Okay, so highest error will be orbital according to this study. Bolton followed by Menton, ANS and P in x coordinate, and in y point A, point B, Pogonion, apex of upper incisor and apex of lower incisor. And they have asked which can be precisely marked. So with the least error possibilities, in which comes both nasion and point A. And in the option we had both nasion and point A. Okay, but point A also comes with the highest error possibilities. So out of nasion and point A, one is more appropriate or more correct than the fourth option. Okay, so just if possible take a snapshot or something of this table. I'll rub it off for you guys. Okay, for you to remember. Highest orbital in x-axis, point A in y-axis, least nasion followed by point A. This is in order, so this is first order, second, first orbital is the highest, followed less bolt-on, less mode. So this is the order which is there. Okay, so I've summarized that. Difficulty in marking and plotting landmarks. Okay, moving to the next question, a very easy question. Which of the following best defines the image given below? Options are mesodense, supernumerary, talus cups, or retained primary tooth. I don't think hardly anyone would have gone this wrong when it came in their exam. Okay, so all of you know it's mesodense. I don't think I need to explain anything in this. Talons, because you can identify retained primary tooth, you can clearly see this is a permanent dentition state. You have additional tooth present. Mesodense is also a supernumerary teeth only, but one which is present between the two central incisors is known as a mesodense. Okay, so we have a person joining. HS, good evening to you as well. Okay, now a question: which analysis doesn't involve mandibular incisors? Now this is a good question. Various forms of this question have come up during subsequent exams post 23 as well, which doesn't involve mandibular incisors. Tanaka Johnston, Stanley Kerber, Pond's analysis, and Moyer's analysis. Doesn't involve mandibular incisors in their calculation. Tanaka Johnston's, Stanley Kerber, Pond's, Moyer's analysis. HS says option 3. Anyone else? No one? Okay, so Pond's analysis is the correct answer. Pond's analysis utilizes sum of upper incisors. So students, in the recent few, yes, you are right, Pond's involves maxillary incisors. In recent times, model analysis have become somewhat more important over cephalometric analysis as in with respect to orthodontics. Okay, previous exam also asked a direct question for you to calculate, so a short discussion or short information from this. Option 1, 2 and 4 is about mixed dentition analysis. Moyer's class analysis, Tanaka Johnston's is the most clinically useful or clinically used. Stanley Kerber is the modification of Higgs and Oldfather. This is the most accurate mixed dentation, and Moyer's is the most popular one, or you can say easiest to do. Okay, or the earliest or the first one which came with respect to mixed dentation analysis. Pond's analysis and Lindenhart's analysis are with respect to permanent dentition analysis. Mostly mixed dentition analysis uses mandibular incisors only. Why? Because they are first to erupt, easy to identify, can be seen clinically. You don't need to upgrade a cast and all that. You can directly use a divider scale and or a caliper to measure it. Okay, whereas most of the permanent dentation analysis involved upper incisors or some of all teeth, depending upon the type of analysis which is being done. Next question, type of question which comes in mixed dentition analysis is for you to calculate. Okay, so in last exam INI only they gave you values. Okay, you had to calculate and measure and give the correct information. So for that you need to remember it was half sum of incisors plus 10.5 or plus 11. The question was on Tanaka Johnston. When the discussion will come up for that particular year, we'll again take up that question. I'm just here highlighting the importance of model analysis right now. Next question which comes, okay, is radiographic method mixed, the classification of mixed dentition analysis. Okay, the classification, they are classified broadly into three types. One using radiographic, radio plus probability charts, and one using probability charts only, no radiograph. Okay, so the next important question is classification. Which of the following does not involve taking radiograph? So Moyers and Tanaka Johnston are the only one which does not require any radiographs to be taken, just measurement on the cast and probability charts. Which of the following analysis does not involve taking probability charts? So only radiographic method. Hukaba analysis, this also came one of your PYQ. So टॉपिक वही है क्वेश्चंस का, एक मिक्स डेंटिशन एनालिसिस. आई थिंक आई फॉर्म 5-6 टाइप. इसके अलावा दे कैन नॉट आस्क यू एनीथिंग. ओके, सो इफ यू रिमेंबर knew all these 5-6, then this topic model analysis for you is complete. Don't know, just go back and 5-6 types which I've just summarized, go through it again. Okay, so that completes the model analysis part for you in short. Okay, next question, rule out the following observation seen in this patient. So this patient, they have two lines which have been drawn, one with respect to upper lip and nose. Yes, you're right, Hukabas is for radiography. Acute nasolabial angle, obtuse nasolabial, ideal nasolabial angle, sharp nasolabial angle. So a form of question, or you can say language modification for the question, rule out the following observation. Acute, obtuse, ideal, sharp. I don't know what it meant by sharp nasolabial angle, honestly. I assume sharp. I don't know what is sharp nasolabial, whether it was a recall problem in this question or not. I don't know what is the meaning of sharp. This. So a tricky way of asking a simple question. You just have to look at the image. Okay, zoom in there. ideal, HS says 4-1 with a question mark. You cannot put a question mark in your exam. Either you have to mark it or you don't cannot mark it. And as I say in INI exam, if you are able to narrow it down to 2, do not leave that question, because in INI there is nothing, either you are in or you are out of the exam. There is no midway that I got a very good rank of, even if there are 30 seats I got 31. So 31 is you are out, you are not part. Okay, and do not assume that if you got a good rank, supposedly in under 50 in INI, you will get the same rank in NEET as well. They are two very different exams. Course is same, but the pattern, the way the questions are asked are very different. Okay, anyhow, coming back to the question. So what we get is, will discuss this question. Rule out the following option. So when I look at this image, based on the lines I saw, they are somewhat tilted like this. So the angle must be less than 90 degree. So if it's less than 90 degree, that means this image is of acute nasolabial angle. Coming to the option 1 is acute obtuse. It is not obtuse angle. It is not ideal nasolabial angle. Ideal nasolabial angle is between 90 to 110 degree. So more towards obtuse. So these two options are roughly same only. Two options same. We have to mark one correct. So 2 and 3 are same only. Sharp nasolabial angle, I don't know what is sharp word. Okay, and when I don't know, I don't think the examiner was also not able to form a fourth option for this question, I suppose. So he just put a word sharp. So that leaves us with acute nasolabial angle. Okay, I hope I am clear with this. So rule out means mark the correct option. Rule out the correct option from the given below 4 options. Okay, a very easy question. Just had to look basic mathematics. Looking at the angles showed less than 90 degree. So it's an acute value they are asking. Now acute mein 2 and 3 options are both same. That leaves you with 1 and 4. Out of this, sharp nasolabial angle is, I don't think there is any word in orthodontic literature which says this is a sharp nasolabial. That leaves you with option 1 only. And since it was a single option correct question, that leaves us with option 1. Okay. Next question. Now it's easy question after a tricky question. Class 2 division 1 malocclusion is characterized by hypotonic lower lip, hypotonic upper lip, hypertonic upper lip, hypertonic lower lip. Grid says 5-2 hypotonic upper lip. Anyone else? HS also says 5th, option number 2. So I won't waste much of your time on this question since all of you know it. It's hypotonic upper lip. So just a quick revision of the difference between Class 2 div 1 and div 2. The profile is convex in div 1, straight to mild convex. Upper lip is short or hypotenuse. Why? Because of proclined upper incisors. Because of this, the lower lip is everted. The lips are incompetent. The mentalis muscle is hyperactive. Why? Because it has to form oral seal. It has to come up the lobe and form oral seal so as to cover up the upper lip and teeth so as to swallow. Lower facial height can be normal or increased. Arch form is the characteristic feature that is square to U shape in class 2 div 2. Mentolabial sulcus is deep. It can be deep or normal in div 2. Another easy question. The appliance used for maxillary expansion is made up of nickel titanium, nickel chromium, nickel cobalt, stainless steel. I think last week only we discussed this appliance and this image as well. Yes, nickel titanium. Yes, so this is a nickel titanium or night-eye expander. We discussed it in the last week session itself. The newest kind of expander, A to M transformation and all that. I think 2-3 exams post this carried the image, the similar kind of image or a similar kind of question based on this appliance itself. Highlights the importance of this appliance in expansion segment. Next question. In Bolton's analysis, 87.3 denotes maxillary tooth excess, mandibular anterior tooth excess, maxillary anterior tooth excess, mandibular tooth anterior excess. HS says 7-1. A easy question on Bolton's analysis. Ansika also says option A. So as I said, model analysis, same value is given. Now they are asking you the inference. So in some few recent exams, model analysis has taken precedence over cephalometric analysis. Earlier cephalometric analysis used to be the topmost thing which used to get asked. Now model analysis has somewhat overtaken it in your recent 3-4 years past year exams, including NEET as well. So yes, option A is the correct, that is maxillary tooth excess. So Bolton analysis was given by Wayne Bolton. Ratio, overall ratio, sum of mandibular 12 by maxillary 12 into 100. So if it's less than 91.3 means the denominator is more, means maxillary excess. If its ratio is more than 91.3, mandibular is more, maxillary is less. Simple. Same goes for anterior ratio as well. Next question. Identify point A. General, maxilla, mandible, reproductive system. I'll zoom in the image as well. It just says general, easy question. It is on this Scammons growth curve. Yes, so it's a general body curve. So quick revision: lymphoid grows up to 200% of their size. एग्जाम में जनरली नहीं है, lymphoid tissue लिखे, they can give you as thymus gland, tonsils, anything which grows to 200% of its size. Yes, you are right. Lymphoid, neural, general, reproductive. Neural is here. Okay, so the fastest or earliest to reach maturity. Now a few important points for your exam. Neural, earliest to reach maturity. Last to grow, reproductive. Slowest to grow, reproductive. S-shaped curve, general. Maximum to grow, lymphoid. Neural tissue reaches 96% of its time by 5 to 6 years of age, and then 100% by 20. The maxillary growth follows towards more neural body curve. The mandibular growth more towards general. एग्जाम में पूछे जॉ ग्रोथ, मैक्सिला मैंडिबल नहीं लिखते, then general. These all questions can come from Scammons growth curve. And lastly, okay, cephalopodal gradient I will discuss later with the question. So these all which can come. Lastly, yes, one more thing, the Scammons growth curve was given by Richard Scammon. This came in your SR exam in the year 1930. So I don't think any more question can be asked from this Scammons growth curve. Okay, sorry. Moving ahead towards the next question. What is the fixed functional appliance given below? So you have to identify the image. Herbs, Rito, Jasper jumper, forces. I'll zoom in the image as well now. HS says 9th 3, that is Jasper jumper. SR also says option 3. Anyone else? So the correct answer is Herbst appliance, not Jasper. So this image you have to identify the fixed functional appliance. Herbst is a rigid fixed functional. Rito is also a rigid. Jasper jumper is flexible. Forces is hybrid. Now how to identify? देखने में सारे एक जैसे ही लगते हैं. सबसे बड़ा है आइडेंटिफिकेशन फीचर फ्रॉम रिजिड टू फ्लेक्सिबल. इसमें एक स्टील बेस लगा हुआ है, मीन्स डायरेक्टली अटैच टू द कैप. यू कैन सी अ ट्यूब मेटल ट्यूब प्रेजेंट. अगर मेटल ट्यूब है मीन्स इट्स अ रिजिड फिक्स फंक्शनल अप्लायंस. इट वोंट अलाउ यू टू मूव एनी काइंड ऑफ लैग. अगर एग्जामिनर वांट्स टू आस्क यू अबाउट अ फ्लेक्सिबल फिक्स्ड फंक्शनल अप्लायंस, it will definitely have a nylon covering, nylon tubing over it, nylon or vinyl tubing that will be colored green yellow color की लगा देंगे. अगर metal steel दिख रहा है, it's a rigid fixed functional appliance, simple as that. और अगर hybrid appliance है like forces, eureka spring and somewhat like that, it will have a like this rigid rod partial covering a nitrile coil spring, somewhat kind of image. They will give you certain clear cut identification features for you to identify in the exam. And FYI, most of the time आज तक एग्जाम में हर्ब्स ही पूछा गया है 95% टाइम्स. 5% टाइम्स जैस्पर जंपर, बाकी दो तो कभी पूछे ही नहीं गए, आइडेंटिफाई करें. ऑप्शन में दिए हैं बट दे हैवंट आस्क्ड. एंड एज आई सेड, इफ यू आर एबल टू नैरो इट डाउन टू ऑप्शन 2 ऑप्शंस 1 and 3, गो फॉर हेड, डू अटेम्प्ट इट दैट क्वेश्चन. एंड इसमें तो डायरेक्टली स्टील रॉड इतनी बड़ी बड़ी दिख रही, हाईलाइटिंग पॉइंटिंग यू टुवर्ड्स दिस हर्ब्स अप्लायंस. ओके, ये स्टैटिस्टिकल एनालिसिस जो मैंने दिए बेस्ड ऑन द प्रीवियस क्वेश्चन, ईयर क्वेश्चन विच आई हैव सीन. सो डोंट टेक इट एज वर्ड बाय वर्ड की सर ने तो कहा था ऐसा ही होता है तो आई वी मार्क्ड इट. ओके, नेक्स्ट क्वेश्चन. अ चाइल्ड पेशेंट केम विद हर मदर विद अ कंप्लेन ऑफ अ पर्टिकुलर अनवांटेड हैबिट. ओके, क्लिनिकल एग्जामिनेशन रिवील्स द फॉलोइंग कंडीशन. व्हाट विल यू नॉट एडवाइस? Removal appliance with cribs, removal with rakes, lip bumper, bluegrass appliance. Can you show one's Rito? I need to Google it. I showed it my exam class. I'll show it to you after this question. Just go through this question and after this question I'll Google it and show you the image. 10-3. Lip bumper, okay. So this image, first image is of a hand more pointing towards the thumb, and next image is of a anterior open bite with proclined incisors and spacing. So unwanted habit. Now thumb is shown, this kind of image is shown, clearly pointing towards thumb sucking habit. Now for correction of thumb sucking, you give cribs, you give rakes, you give bluegrass appliance. You do not give lip bumper. So for what purpose do you give lip bumper? For hyperactive mentalis muscle activity. Yes, callus formation is seen. Okay, important for you to remember is see the image of bluegrass appliance and identify it, and for what purpose it is used. Okay, lip bumper, hyperactive mentalis activity to shield away the overactive mentalis muscle. Okay, and when this lip bumper, this is generally given in the lower arch, when it is given in the upper arch, then it is known as same thing, Den holds appliance. So this becomes your another MCQ for this appliance. Image identification uses can be used for distalization, anchorage, shield away the hyperactive mentalis activity. Okay, image identification, and next Denholtz appliance. This completes your lip bumper. Anything else cannot be asked from this square. Okay. Now someone asked me to show you the image of Ritz appliance. I need to Google it. Rito appliance. So this is the image. I cannot draw, but in Rito appliance, if you can see, it will have this kind of a stopper present, the one which I have zoomed into. The specific feature for this appliance is you don't need to bond the entire arch. This stopper, you move it forward like this, will take the mandible. So multiple activations can be possible with the same appliance. Presence of this stopper kind of a thing is a significant feature of this Rito appliance. Simple, very easy and versatile in use. Okay, but although it's a rigid fixed function appliance, so not much use. Okay, so coming back to the questions in hand. So similar kind of question I mentioned in our last discussion last week. A 7-year-old patient noted with a single tooth cross bite in maxillary anterior region. What will be the treatment advised? Leave it as such as it is self-correcting. Fixed appliance in later stages as the child is growing. Immediate intervention to correct the crossbite and extraction. Similar kind of questions with these options and this explanation, I discussed it last week. So those who attended or saw my previous YouTube video will be able to grasp this concept quickly. Third option, immediate intervention to correct a cross bite. Yes, so that is the correct answer since the child is 7-year-old. Okay, so that's what I mentioned, developing cross bite. How will you correct it? Tongue blade therapy, cat lens appliance and all that. Cat lens appliance, I said, is examiner's favorite appliance for correcting. Lower anterior inclined blind plane, upper anterior inclined blind plane, upper flat blind plane uses, posterior blind plane uses, we have all discussed. I think in YouTube sessions only I have highlighted these importance of bite planes. Okay, so a question on bite plane, I don't think anyone should किसी का गलत होना चाहिए वो question. Okay, moving ahead. A 3-month-old child, 45° for cat lens. Okay, and 70° for which appliance then? The inclination, if you can tell HS or anyone. (70° incline for which appliance? This is question for everyone, not particular to him. Twin block. Yes, right. Okay, yes, right. Twin block. So a 3-month-old child. Coming to this question, 12th question. It says option 1, nasoalveolar molding, was brought to the hospital with the complaint of regurgitation. Clinical presentation is given in the claimage. What will be the non-surgical treatment in this condition? Molding, obturator, alveolar bone grafting, medical management. NAM. सबने एक किताब पढ़ी है प्रीवियस ईयर की एंड उसी के बेस पे विदाउट थिंकिंग आंसर कर रहे हैं. नैम आंसर. व्हाट इज regurgitation? If anyone can write in this comment section quickly. What is regurgitation? Easy language में, nothing scientific I am asking. Regurgitation का मतलब क्या है? Now someone changed it to option 2, obturator. Now when I am asking about regurgitation, everyone changes it to option 2. Yes, option 2 is the correct answer, obturator, for this question, not nasoalveolar molding. This answer was given in your answer key of various institutes and various and other books. Yes, fluids and food enters from the oral cavity to nasal cavity. Yes, right. So how can nasoalveolar molding prevent this? You have to give a palatal seal or an obturator to prevent this flow. Nasoalveolar molding will only close the lip. It won't prevent this regurgitation. Okay, this was the incorrect answer which was mentioned in the books and answer key of some other institutes as well. Okay, as I said, that's why I say questions pick up har jagah se uthao, verify this answer with the respective subject faculty before answering. Okay, easy question, directly you would have lost 5 marks in this. Okay, I hope I am clear now. Yes sir, reverse flow. A question next, a big question. A 25-year-old patient visits a craniofacial clinic for a comprehensive assessment. During examination, clinician wishes to classify the shape of the patient's head based on the cephalic index. Measurement obtained per maximum cranial width of this and cranial length of this much mm. Calculate the cephalic index and determine the head shape class. Which of the following question best describes the patient's head shape? Dolichocephalic, mesocephalic, brachycephalic, none of the above classes accurately describes the patient's head shape. Now this is a somewhat kind of weird kind of question when they are providing you with values and they expect you to do a mental calculation to get the answer, and that too the values are in decimal places. So for this, two things you need to remember: the correct formula, okay, the classification, and good in mathematics in head. So if you are able to reach, luckily I did not get such kind of question in my time. Okay, otherwise I would also would have skipped this question and moved ahead. So though easy question, but mathematically for me it would have been very difficult sitting in the exam to calculate this much amount of calculation, that too in decimal places. So anyone can do that, very well, answer it. Otherwise this question I can say, if you're not able or if you don't have time, don't waste your time doing such kind of calculation exam. Just skip it and move ahead. because I don't have any tip and trick for simplifying mathematics at this point of time. Okay, so Nikita says option 3. So yes, brachycephalic is the correct answer. So this is the cephalic index, skull width by skull length into 100. Important thing is it was given by Anders Retzius, also known as Retzius index. Okay, and the classification was given by Martin and Seller. This is the classification. Similarly, you have classification for facial index as well. This index was given by Coleman, also known as Coleman index. Yes, I know that. That's what I said. In 9, I know none of the exam gives you paper, I think, to calculate and paper and pen to do such kind of mathematics. That too in decimal places. Okay, so one question like this, if it's difficult for you, it's going to be difficult for the rest all people sitting all over India for the same exam. No one is like a supercomputer who can do mathematics with a tense mind at that stage. That's why I said if you are able to do it, attempt it. If you're not, let the question rest in peace and move ahead to the next question. Do not waste your time, okay, over this question कि नहीं ये तो करना ही है, इसके चक्कर में you will waste your time because you have section based type question paper now. You will lose out important marks on other questions which are much more simpler, and due to permutation and combination such type of question can come as first question as well in your exam, and for someone else could have this question and the end. ओके, सो फर्स्ट क्वेश्चन नहीं आनी नहीं तो करके ही छोड़ना है. फर्स्ट क्वेश्चन तो खाली नहीं छोड़ सकते. नहीं, you waste 10-15 minutes, okay, that is on the higher side I'm talking. Okay, you waste 4-5 minutes of your time on such question. That is of no sense according to me. Okay, if you have a pen paper, then go ahead, do attempt it. Only paper you have is that admit card, no pen, I think. Next question. An orthodontist is studying a cephalometric analysis presented on a graph to determine the skeletal and deltoid relationships of a patient's facial structure. The graphical representation displays several polygons and angular measurements, like the facial angle, angle of convexity, y-axis angle, and more. Identify the displayed graph. Now they have pointed these values, these angles as well, which is part of which analysis? Downs and polygon, Wiley's polygon, Adam and Voorhees polygon, floating polygon. This is the image of this polygon. I am zooming it. HS says option A. You have to identify the displayed graph. Bhumi says downs. You have to identify the displayed graph. So the correct answer is Adams and Voorhees polygon. So these values दिखा के they just wanted to confuse you. These angles were given by in Downs analysis. but this polygon of graphical representation was given by Adam and Voorhees. Okay, polygon or wigglegram. It is a effective way of illustrating the static cephalometric analysis. Okay, it was initially introduced by Hellman, who was also gave you that facial analysis as well, Milo Hellman. So Down's polygon was suggested by Voorhees and Adams. Next type of question which can be asked, values if more of the values are pointing towards left or right side. So left side more class 2, right side more class 3. Who gave it or which analysis? Left and right side. So left side more class 2 and right side more class 3 type of pattern. Next question. Patient came with the complaint of gum issues and bleeding while brushing. After functional examination of this patient, which appliance should be included in the management plan? Activator, oral screen, bluegrass, Hawley's appliance. So the first line pointed seemed like a perio question. Next line, never seen this graph. I have discussed this in my class and on the cephalometric analysis YouTube session as well, Nikhil. Okay, so it's a graphic, it's a very easy graph, nothing. The midline is the average value of the Down's values, left and right extremities represent the range. So on a cephalometric analysis, supposedly you get a range as 81, okay, 11 degree, okay, -8. So if most of the values are towards the left side, then it indicates a class 2 skeletal pattern. If it's more towards the right, it's a class 3 skeletal pattern. So that's how it's clinically used. Okay, so we have discussed this in class and I have done this on a YouTube session as well on cephalometrics. So you can go through this post this lecture. Okay, coming to the question, HS says 2 marginal gingivitis due to mouth breathing. That values and all were there to confuse you. So examination reveals bleeding and while brushing. So as he has already mentioned, HS that it's a due to mouth breathing habit. So oral screen, bluegrass appliance for thumb sucking, activator for class 2 or 3 correction, and Hawley's appliance simple for retention or anterior proclination correction. That leaves you with oral screen for mouth breathing. Remember, it's Hod's modification of oral screen and all that things. It's a functional appliance. And lastly, yes, oral screen is also a functional appliance. It works on which principle, which theory of growth? It's also functional appliance. If anyone can answer, which theory of growth does it utilizes, or which theory of growth its functional is based on? Oral screen. Remember, theories of growth theories. Just name, I'm asking, name of that theory. Functional matrix theory. Yes, right. FMH. Okay, so remember that not only just one appliance only is working on FR appliance. Okay, the oral screen also works on this functional matrix theory for myofunctional correction, that is class 2 correction. What is the appliance given below? A easy question. Twin block Frankel activator posterior bite plane. 16 1 1. So yes, you are right. It's a twin block appliance. Frankel activator posterior bite plane images you all know. It's a very easy question. Okay. Surgery first orthognathic treatment for all of the following except mild anterior, mild procline, mild curve of spee, class 2 with TMJ problem. In your exam, examiners have a tendency to write abbreviations as well. So surgery first orthodontics can also come as SFO. SFO treatment for all of the following except. So exam में don't get confused. SFO क्या चीज़ है? It's just surgery first orthodontics. Option 4. So it's a very easy question. So those of you who don't know about surgery first also, by looking at the options you can rule out. First three options are all pointing towards same thing only. Mild anterior, mild proclination, mild. So ruled out directly. That leaves you with option 4 only. Class 2 malocclusion with TMJ problem. So surgery first was given by Sugawara and Nanda. Okay. So well aligned to mild crowding, flat to mild curve of spee, normal to mild proclination or retroclination, and mild transverse discrepancy. So in those cases you can go with surgery first orthodontics for correction of skeletal malocclusions. So a little bit information for your exam. There are broadly two types of surgery first approaches: orthodontically and surgically driven style. Okay, solves orthodontically means solves both skeletal with orthognathic and dental with SAS, that is skeletal anchorage system. Okay, surgically driven is all problems with orthognathic surgery. Most jaw deformities are indication except for a few specific type of cases. Indications are mentioned. Occlusion should be set up to reveal the true extent. Occlusion for a treatable class 1. Malocclusion with tripod occlusal contact. The use of skeletal anchorage system in orthodontically driven and skeletal and dental problems are solved surgically, so it is not required. So for your exam, just remember there are two approaches for SFO. Okay, this concept was given by Sugawara and Nanda. Criteria as I mentioned. Advantages: saves time. The treatment is faster as compared to the traditional approach. Okay, so these are the two broad categories of surgery first approach. Now the questions are how to remember so many inventor name. So for that, what I used to do is there are certain names which come up repeatedly in every subject. Okay, one person has given this. So either you can write them down on a piece of paper and stick it in front of you, so that daily when you get up, start your day, you can go through that. Okay, similar kind of problem I used to face in oral radiology. I was not able to remember those CWT values and all that for different things. So what I did was I wrote it on the paper and stuck it on my table in front of me, so that daily I was able to see them and revise them. This goes for anything which is a problem for you. जो याद नहीं रहता, बार बार slips out, stick it in a paper and stuff. And there can be many things. I'm not saying one names only. There are many things which is possible. Just print it, write it on a piece of paper, A4 size, and paste it on the place wherever you study, on the table in front of that wall or anything. Okay, next, most of these inventors have certain things which they have given. Okay, so for that you need to do mind mapping kind of thing. वो repeatedly, अच्छा ये नाम वहाँ भी आया था, that person has given, so just revise, keep on revising that thing. This name person has, like I said, Milo Hellman and name at tip. So this person gave this classification system as well in diagnosis, facial classification system as well. Same person again comes in Downs analysis as well. Okay, like SNA SNB was given by Riedel. Their Riedel's theorem is also there in retention. So like this, you have to map like वहाँ भी यहाँ भी, then only you can remember them. Okay, so that concludes our discussion of the May 2023 Orthodontics INICET. So next week we'll be back with the another session, another paper. Okay, till then, as I said, now the clock has reversed for your November exam. Do give 2 to 3 grand test or full course complete test per week now onwards. Today's 1st September. Okay, nothing subject wise will do. Now full course test should be given. मेरा course complete नहीं हुआ, आधा हुआ है, 3/4 हुआ है. After that you will give. वो after that कभी time आएगा ही. Get into that nag वो टाइम पीरियड का टेस्ट देने का एंड ऑल दैट, क्योंकि जब 19 सब्जेक्ट सामने होंगे देन कैसे माइंड का चलता है, माइंड को उसकी आदत डालनी पड़ेगी. अभी माइंड एक सब्जेक्ट को देखता है, उसको यू वॉमिट इट आउट. ये है व्हेन 19 सब्जेक्ट्स आर मिक्स्ड एंड मैच इन फ्रंट ऑफ यू, देन हाउ दिस माइंड वर्क्स, दैट इज हाउ यू हैव टू ट्रेन इट. नाउ आधा कोर्स हुआ है और आईएनआई का फॉर्म ज़रूर भरना है, दोज हु आर एलिजिबल. डू नॉट डू दैट कि मेरा कोर्स नहीं हुआ है, मैंने तो अभी शुरू किया है. इफ़ यू आर एलिजिबल, डू गिव इट. ओके, डू गिव इट. यू शुड फील अ नैग कि भाई ये कैसे होता है, एग्ज़ाम का सेंटर जाना, ये सब करना. वो ग्रेजुएशन से अब तक भूल चुके होंगे आप सब. ठीक है, 5 years हो चुके हैं. So that's all I can say. If you are eligible for the exam, do attempt it. So that's it from my side. Any doubts, you all know where to reach me. I will be very happy to answer any of your queries related to orthodontics. Okay, anytime you have my number, you can text me. Okay, so thank you once again. Sorry for the delay in starting the session today. Okay, so I'll close the session. Thank you and good night, and keep on